Thank you so much for your interest in our study. My name is Maddie Matheson. I'm a nurse practitioner and I work on the Mantyh Lab team. This video will give a detailed explanation of what participants in our study can expect at each appointment if they have memory or thinking issues and choose to enroll in the full examination and assessment to investigate these problems. I will be discussing what happens during the initial exam, blood draw, and MRI scan, as well as how test and examination results are communicated with participants. As a reminder, participants are not required to complete all appointments described in this video. It is meant to be used as a tool to help you understand what each appointment entails and decide whether you would like to participate in that portion of the study. As I mentioned, there are 3 components to the full study assessment. These include an initial exam, blood draw, and MRI scan. The first component of the study is the initial examination. For this portion, you will meet with Dr. Will Mantyh or myself. We will begin by going through the consent paperwork with you in detail to ensure that you understand the study goals, testing involved, risks, benefits, and remuneration process. Once we have reviewed this packet with you, you will be given the option to sign the consent and continue to the medical examination, or choose not to participate. There is no penalty for choosing not to participate, and participants in our study can drop at any time and for any reason. The next step in the process is to discuss your past medical history, what medications you currently take, your family medical history, and your social history. Your social history includes things like what you do for work and what kind of educational background you have. We also ask about any current or past drug and alcohol use. Once your history has been reviewed, your provider will then ask about any concerns you are having related to your memory. The more detail you can provide us, the better. Think about when these concerns started and what the first symptoms were. Was there any significant event that triggered these changes? Has your memory stayed the same since this change, gotten better, or worsened? We will ask about how these changes have impacted your day-to-day life. Has anyone had to take over specific tasks for you because of your memory? For example, has complex paperwork become too challenging for you, or are you unable to cook dinner? Following this discussion, your provider will perform memory testing with you and a physical examination. Finally, we will discuss the exam findings with you and offer insight if follow-up is recommended. The next component of the full examination is the blood draw. The blood draw is an optional part of our research study. By drawing blood, we can look into nutritional, vitamin, and hormone imbalances that can be related to changes in memory. We will also complete genetic testing, which will be used to include American Indians in the research for the new lab test that is being created to test for Alzheimer's disease. A licensed medical provider will perform the blood test. We may be able to draw your blood the same day that you are seen for your initial appointment and exam. However, if this is not possible, we will work with you to schedule a time and place to have this completed. This blood test is similar to those you may have experienced at your primary doctor's office. A small needle will be inserted into your forearm and a small amount of blood will be drawn. The needle insertion can cause some minor discomfort, but this should be temporary. The entire procedure will last less than 5 minutes. The final component of the full examination is the MRI scan. The MRI scan is another optional part of our research study. The full name for MRI is magnetic resonance imaging. This is a large tube-shaped machine that uses magnetic fields and computer-generated radio waves to create detailed images of the structures and organs in the body, in this case, your brain. A brain MRI scan is a non-invasive way for our medical providers to look at the structure of your brain and its surrounding tissues. If you choose to have a scan completed, you will be scheduled for an MRI at one of our partnering medical centers. You will be asked to lay flat on a table and hold very still. Next, your head and chest will be placed into the machine's tube. This process takes about 40 minutes to complete. MRI machines make multiple clicking and beeping noises, which can be bothersome to some, but no pain is involved. You will be provided hearing protection, given how loud some of these sounds can be. The results of your scan will be interpreted by a neuroradiologist and will be reviewed with you by our medical providers. The results of your testing will be shared with you during your first appointment. Your provider will discuss possible causes of memory problems and answer any questions or concerns you may have. A summary of this appointment will be provided to you for your records and will include our team's contact information. We encourage our participants to reach out with any additional questions that may arise. If you choose to participate in the blood draw and/or MRI scan, you will receive a phone call from Dr. Mantyh or myself to review these testing results with you. We will also provide recommendations for follow-up if any abnormalities are found. This information will be included in your participant summary, which will be delivered to you via mail or encrypted email, whichever you prefer. If you have any questions or would like to speak with one of our team members for any reason, please do not hesitate to call or email us using the information provided on your screen. We encourage you to visit our website to learn more about our team members and current projects. We sincerely appreciate you taking the time to learn about our study, and we hope to hear from you soon. Thank you.